Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success and the Center for Hormone Health and Wellness. I want to talk just a couple of minutes about BHRT. BHRT, what does it mean? Okay, and how can it help you? The big picture. All right, BHRT stands for Bioidentical Hormone Replacement Therapy. Now, HRT, hormone replacement therapy, that's a fairly straightforward concept. Basically, we're talking about the sex hormones, both testosterone and estrogen, and we're replacing them. So as we age, and this happens to all humans, both male and female, as we age, hormone levels tend to drop down. Now, women know this because they go through menopause, but men also, their hormones drop down as well. So both men and women are potentially candidates to undergo hormone replacement therapy. So that's fairly straightforward, kind of what that actually means. So the tricky part of that discussion really was the BHRT. That stands for bioidentical. What does that actually mean? Bioidentical means that the hormone itself, testosterone or estrogen, looks exactly the way your body made it, meaning that it looks exactly the way your estrogen, the estradiols, the main one, or your testosterone, it looks exactly the way you made it. Now, all humans, male, female, black, white, whoever, all humans, their testosterone and their estrogen looks exactly the same. So it's not like it's for any specific individual. It's like, no, this is human. Okay. So all humans, the testosterone in them looks the same. The estrogen in them looks the same. So bioidentical just means it looks exactly the way your body made it. Now, why do we care if it's bioidentical or not? Because synthetic hormones basically mean that it doesn't look exactly the way your body made it. And when something doesn't look exactly the way your body made it, typically then your body won't know exactly what to do with this difference. And so they potentially are metabolized and broken down slightly differently. They may still give some of the same good effects that we're trying to reach with treatment, but if they're broken down a little bit differently, then those breakdown products also have to be processed, and that's where potential problems can come in. Bioidentical again means it looks exactly the way your body makes it. So therefore your body knows how to utilize it. It knows which receptors should get it, and subsequently how to break it down just the way it always did throughout your lifetime. And with this, then, it tends to be a safer hormone replacement. So bioidentical means it looks exactly the way your body made it. Synthetic means it doesn't quite look the same. And why would there be a difference there? Well, some of it is just, say, financial, and that a drug company, a pharmaceutical company can't patent anything that occurs in nature. So bioidentical testosterone, bioidentical estrogen looks exactly the way your body made it. So it occurs in nature. Therefore, a pharmaceutical company can't patent that and utilize it for treatment or selling treatment. Subsequently, they use synthetic hormones, means it looks mainly like the body made it, but not quite exactly. And the problems come in is that it may not receive the correct message. Your body may not see the exact correct message, and it may be broken down a little differently. And subsequently, then this is where potential problems come in. All right. So if you're thinking of doing hormone replacement therapy, I would encourage you, one, come see us, but number two is that utilize bioidentical hormone as part of your treatment plan. Thanks for listening. We'll talk soon again.